Hello, my name is Nathaniel Burmeister. I'm doing my head-to-toe assessment video with my patient here. I'm going to get started. Can you just start by saying your name and age?
Anna Burmeister, I am 27.
So, in general, just first glance of the patient's general state, the patient appears to be in good nutritional health for her height and body to weight ratio. The patient is exhibiting good posture. The patient has properly aligned body positioning, no deformities or abnormalities noted. The patient's mood seems to be appropriate, affect seems to be appropriate. I'm looking her right in the eye. Speech seems to be in line with her cognitive abilities and appropriate for her age. No abnormalities with hygiene noted. So from there, I'm going to go to a skin assessment. The patient has on long sleeves, so I guess we're going to have to pull her sleeves up here and just go through the motions of it. Really, there's no bruising noted with the patient's skin in the upper or lower extremities or in general. So skin seems to be overall intact. Moving forward to the face, patient's face and facial symmetry seems appropriate. No unsymmetrical or abnormalities or deformities noted. Would it be all right if I did a palpation of your face? Okay, so I'm going to palpate the patient's face, obviously being respectful. Just palpating the hair, looking for any kind of bumps, bruises, lumps, abnormalities. The patient's scalp, hair, and cranium appear to be all within normal limits, nothing abnormal noted. So a few extra things. Could you clench your teeth? Okay. Could you stick out your tongue? Okay. So those are both appropriate and within normal limits. At this point, I'm going to palpate your sinuses, and I want you to tell me whether or not you're experiencing any pain. Okay. Any pain? Okay. So no pain and within normal limits. I'm just going to inspect kind of the external structures of the patient's face, including the brows, her lips, her lashes. Nothing really abnormal besides maybe a little dryness of the lips. A little bit of lip balm will take care of that. And thus, so I'm going to move forward to the eyes, just kind of at a glance. No, everything looks within normal limits. I'm just going to do a quick inspection of your eyelids, if that's all right. Expecting the conjunctiva. Pink, no discoloration or anything noted like that. At this point, I'm going to move on to a focused eye assessment. So what I'm going to do is I have a light here, and I'm just going to ask you to look straight at me, and I'm going to shine a bright light in your eye, okay? So we're going to move from one field of vision inwards. Excellent. Okay, so pupils are equal and reactive to light. One other thing I'm going to do is I'm going to ask you to just look at this light. Keep your eyes, your face straight ahead, but look at this light with your eyes, okay? So at this point, we're testing the 6 cardinal positions. So follow this with your eyes. Okay, so EOMs, corneal light reflex, 6 cardinal positions of gaze, all within normal limits, no abnormalities detected. And at this point, I'm going to assess near vision. Looking for my little paper with the notes on it. Here it is. Okay. So this is to test your near vision and whether or not there's any abnormalities there. So what I need you to do is cover one of your eyes. Read this top line.
The northern countries of Europe.
Okay, now cover your other eye. Read this bottom line.
They seem to
Okay, so she read both lines appropriately. There seem to be no issues with her near vision. So at this point, we're going to move to inspection of the ears. Could you pull your hair back for me, ma'am? Okay, so I'm just going to externally inspect the ears. Making note of any issues or abnormalities. Just from inspection, there seem to be no problems. I'm going to move on to palpation of the auricle and the tragus. Is there any pain when I'm palpating? Okay, no pain noted. on the left or the right. Is that correct? Okay. So I'm going to move on to an inspection of the external nose. Nose seems to be centered midline of the face. No abnormalities or deformities noted. Also, I'm going to test patency of your nose, so I'm going to cover one of your nostrils and just ask you to blow out the other one. Blow hard. Okay, both nostrils appear to be patent. Moving forward, I'm going to do an inspection of the mouth, lips, and inner mouth. So could you say ah for me? Okay, I'm going to get my light here. Sorry, ma'am, could you say ah? Okay, tonsils appear to be healthy within normal limits. Normal movement of the uvula, it's midline, so all that appears to be normal. I'm going to move on to an inspection of the neck. On the first glance, there's no abnormalities noted, nothing of note there. At this point, we're going to move on to a range of motion test for the neck. So, ma'am, could you move your head to the side? Now the other side. Now move your head back, looking at the sky. Now looking at the floor. Okay, look straight ahead. I'm going to put my hand on your face and then press against my arm. Okay, perfect. Other side. Okay, now I'm going to be testing your shoulder strength. Can you move your shoulders up towards the sky? Press against me. Okay. So shoulders and neck seem to have proper range of motion and good strength. At this point, I'm going to palpate any lymph nodes and check for any swelling. So I'm just going to be palpating you here. Okay, no signs of any swelling or masses on the lymph nodes, so that's within normal limits. At this point, I'm going to palpate your pulse, if that's okay. So we'll palpate the carotid pulse on the right side. Present and strong. Present and strong on the right side. Left side as well, I would say maybe a +1 or 2. At this point, we're going to move on to an inspection of your posterior chest. So if I could ask you to just spin around for me, move your hair to your front if you could, that way I can make an inspection here. I'm going to be using my stethoscope soon, so I'm going to get that ready. But what I'm going to start by doing is just a visual inspection. Just breathe normally, ma'am. There appear to be no signs of deformity or respiratory distress right off the bat. We're going to move forward, and I'm going to do a palpation for chest wall expansion. So I'm going to put my arms on your back, if that's okay.
Yep.
And I just want you to take a deep breath, several deep breaths. Just breathe normally, deep breaths. Okay, I'm feeling appropriate chest expansion. Everything seems to be within normal limits. You can breathe normally. So next of what I'm going to do is a technique called tactile fremitus. Every time I put my hand on your back, I want you to say the words 99. Is that clear?
Yes.
Okay.
99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99.
Okay. So that's appropriate and within normal limits. Next thing I'm going to do is percussion of the lung fields. Tell me if there's any pain that you're experiencing right now. Also, I'm just assessing for any resonance or abnormalities noted. Okay, that all seems to be within normal limits. The next thing I'm going to do, ma'am, is I'm going to give you almost like a light tap on your kidney, and I want you to tell me if there's any pain. Okay, we're assessing for any issues back here of flank pain. So you tell me if there's any pain.
No.
Okay, so that's within normal limits as well. So I'm going to move on to auscultation and begin to assess breath sounds. Every time I touch you with my stethoscope, if you could take a deep breath for me. Perfect. Now if you could do me a favor, spin back around, face me. So that's the anterior breath sounds at this point. Thank you very much. At this point, I'm just going to move on to a visual inspection of the precordium. So, right off the bat, there's no abnormalities noted, no deformities, nothing visually that's going to throw us off. At this point, I'm going to palpate, ma'am, if that's all right with you, find the apical pulse and point of maximal impact, which would be mid-clavicular line, 5th intercostal space. So, I'll palpate here. Okay, right about there. Okay. So right now, while I'm palpating and finding the pulse, I'm palpating for any thrills or heaves that are noted. I'm not noting any abnormalities. I'm going to move on to auscultation of heart sounds. Okay, and I'm going to count the heart rate at the point of maximal impact with the apical pulse. Okay, heart rate is approximately 75 beats per minute. No murmurs or abnormal arrhythmias or irregular heart rhythms noted at this time. At this point, I'm going to help listen again, but with the